Bread is an essential part of many American family meals, from rolls with dinner to toast and eggs for breakfast. According to study, several whole grain, sprouted, and protein-rich breads may aid in blood pressure reduction and weight loss. In many circumstances, bread may even be a healthy food to include in your diet. However, there are some unmistakable indications that bread is unhealthy for your diet and your health. Learn more about the definite signs that you should stop eating bread right away by watching on. Don't forget to subscribe for more videos about natural ways to improve your health. Number 1, it makes you gain weight. Reduce your intake of bread if you see that your weight is steadily rising on the scale, especially if white bread is your go-to carb. Eliminating white bread from your meal is a great place to start if you want to reduce weight. According to a 2014 study that was published in the journal BMC Public Health, eating 2 or more servings of white bread per day significantly increased the chance of being overweight or obese. Number 2, high blood pressure. Eliminating bread from your diet may be the simplest approach to lower your blood pressure, regardless of how long you've struggled with hypertension or how recently you've discovered that it is raised. According to a 2018 study in the journal Nutrients, eating just 1 piece of white bread once or more a week was linked to high blood pressure. With fact, many popular breads almost reached the World Health Organization's daily salt intake target in just a 2-slice meal, according to the 2018 Global Bread Survey by World Action on Salt and Health, also known as WASH. Number 3, stomach cramps. If you notice that your stomach feels terribly unpleasant after consuming a sandwich or a slice of sourdough, it's time to stop eating bread. According to the Celiac Disease Foundation, people with celiac disease, an immune disorder brought on by gluten, frequently experience extreme bloating, pain, diarrhea, and constipation after consuming foods that contain gluten, which most breads do. Number 4, develop a rash. That sudden rash shouldn't be written off as a simple contact dermatitis. Rather, it can be a sign that you need to stop eating bread right away. According to the National Institute of Diabetes and Digestive and Kidney Diseases, other body parts can also be afflicted. The back, buttocks, elbows, knees, and scalp are the most often affected places. Dermatitis herpetiformis will develop in about 10% of celiac disease patients. Number 5, blood sugar. You may want to reconsider your bread intake, at least temporarily, if you recently received a diagnosis of diabetes or pre-diabetes. Refined sugar is a common ingredient in commercially accessible bread, which poses major health dangers for people whose blood sugar isn't well controlled. People with diabetes who decide to include bread in their diet are advised by the American Diabetes Association to choose whole grain bread as the first item. Number 6, constipation. Processed grains are used to make white pasta, white rice, and a number of pastries and baked goods. When a grain has been treated, the bran and germ have been removed. Since the bran is a part of the grain that contains the highest fiber, constipation could become an issue. Think of the cereal bran flakes. Wheat bread is particularly rich in insoluble fiber. In other words, it bypasses your digestive tract without being absorbed or digested. This is good news for anyone who experiences constipation, since the undissolved fiber gives stools more weight and shortens the distance food must travel from your mouth to your intestines, making it easier for items to pass through. You can understand how, without this essential nutrient, you would eventually start to feel backed up. Thank you for watching, and as always, please don't forget to subscribe for more videos like this.